11-year-old Matthew was diagnosed with a rare kidney disorder at the age of 5 weeks. He waited more than a decade before he was able to get a life-saving kidney transplant. That is 10 painful long years of dialysis in a childhood without tag, sports, and all of the things that children love. Matthew was one of the lucky ones who was able to have an altruistic donor. But that is not the norm. Sadly, more than 2,000 dialysis patients will die today. These are mothers, fathers, sons, and daughters, all of whom would have lived full, healthy lives if they had been able to get a transplant. My name is Rohan Panday, and today I want to talk to you about how we can create a simple and efficient solution to the organ transplant problem. Before we can dive into a solution, we must first understand the current system of organ transplantation. For the purposes of this talk, I will consider one organ in one country: kidneys in the United States, a nation whose system mirrors many around the world. In 1984, the United States Congress passed the National Organ Transplant Act, which, among other things, outlawed compensation for organs, meaning that you cannot buy or pay for an organ. The result of this is that the altruistic supply of organs runs out quite quickly. If it were me needing an organ in the United States, I'd be very concerned because I might die before I get the life-saving transplant that I need. It seems that there are some factors or costs that are deterring people from donating their organs, likely the time involved. When you undergo surgery for a donation, you cannot go to work or engage in strenuous activity for 2 to 3 weeks. To incentivize people to donate and to make donation more accessible for everyone, many countries have allowed compensation for time and salary lost. While that is an excellent first step, the empirical data shows us that despite these changes, waiting times for organs can be just as long. As such, it seems that there is some other factor deterring people from donating their organs, likely the risk involved. The risk of death for a donor during a kidney transplant is about 0.0003%, which is incredibly low. That's good news for a lot of us who are concerned about donating. You are 32 times more likely to die in a car accident. Nonetheless, there is a risk involved, and we can compensate for it. When you compensate for the cost of time, risk, and loss of an organ, you can then create a simple solution to the organ transplant issue. Nobel Prize winner Gary Becker and Professor Julio Elias of the Universidad del SEMA, an instructor of mine while I studied this subject, explained in their seminal paper that once you can put a price tag on an organ, you can then create a legal market structure to buy and sell organs. I believe that if we were to create such a market structure, we could eliminate the worldwide shortage of organs and save hundreds of thousands of lives. Before I go any further, let me be very clear about the definition of the market that I'm using. A market is a non-physical system that facilitates the exchange of a good, in this case organs, for a cash incentive. I know that markets have a reputation for being exploitative or favoring one side over another, but in reality, markets generally benefit all parties involved. Think of it like a supermarket. The owners of the supermarket import goods and sell them to consumers for a profit, and the buyers are happy because they not only get to eat, but they don't have to grow the food themselves. In the case of organs, the donors are happy because they get to make money and they get to save another person's life. And the recipients are happy because they get to live a long and healthy life. When you introduce a market system, you increase the altruistic supply of organs because people now have a monetary incentive to give. In the current system, the recipient pays for the cost of the surgery, which covers the cost of time for the physicians, the instrumentation used, facilities, medications. In a market system, they would also have to cover the cost of the organ, which in the case of a kidney is estimated to be about $15,000, making the total cost of a transplant surgery about $175,000. The extra cost in a market system would go to the donor as an incentive to give their organs. Creating an incentive for donors is quite important because when we increase the altruistic supply of organs, we also decrease waiting times, which is incredibly beneficial in many ways. First of all, because dialysis is not a sustainable solution. The unemployment rate for dialysis patients is about 80%, and it costs around $80,000 a year for 3 to 5 years on average. This total cost is much greater than the total cost of a transplant, even with the market system. The money saved here would benefit everyone, because more often than not, it is the government that is footing the cost of transplants, or of dialysis, through Medicare or Medicaid. In 2016, for example, the US government spent more than $35 billion on dialysis treatment. This money could have gone towards education, healthcare reform, prison reform, and mental health programs. With the ongoing COVID-19 pandemic, the situation in organ transplantation is more dire than ever. When the pandemic hit, many countries curtailed their transplant programs. This recess in organ transplantations has resulted in waiting times for organs getting much longer, as people are added to the end of the list without many people being removed from the front. Additionally, many physicians are finding that COVID-19 causes long-term heart, lung, liver, and kidney deficits in patients. The people who survive this pandemic will likely be added to the already lengthy transplant lists in the future, meaning that this is an issue that we need to act on now. At this point, I'm sure some of you have realized that despite the economic and social benefits of this idea, there is really only one reason why it hasn't been implemented yet: moral repugnance. And look, I get it. Selling your organs doesn't sound great on paper. However, Professor Elias found that people were 20% more receptive of the market system when they received educational material on the subject. That's incredibly significant because people are generally very hesitant to accept any form of repugnant transaction. What that also tells us is that if we present people with a simple, safe, and non-exploitative system, they will be willing to consider it. And a lot of their fears are probably caused by the worldwide black market. Every year, thousands of people are abducted and coerced and have their organs taken from them. Young men and women. In one case in India, a 4-year-old girl whose parents found that she was missing a kidney after an unrelated surgery. The worldwide black market is estimated to generate between $840 million and $1.7 billion in revenue. That is a lot of illegal transplants. The good news is that a legal market structure would likely eliminate our reliance on a black market. A study from the WHO found that black market organs are likely much more expensive than legal market organs would be. Additionally, a black market thrives on the concept of scarcity, or the lack of something. A legal market structure removes the scarcity of organs by increasing the altruistic supply, making a black market obsolete, and our cities, streets, and societies safer. Still, I'm sure some of you are skeptical of how we could implement this idea in the real world. Well, there is one country in the world with a system even remotely similar to this: Iran. In Iran, donors and recipients can meet, and the donors receive compensation for their organs. But the system is not standardized and it's not regulated. Study after study has found that despite Iran's poor corruption index, the country's transplant system is safe and deters trafficking and exploitation. Another study found that in the country, access to organs across economic groups is equal. What that tells us is that if we were to create a more regulated and a more standardized version of the Iranian model, we can create a fair and open transplant system for everyone. I will admit, even if we create the safest system possible with the best laws and the best lawmakers and the best enforcement, there will still be people trying to exploit the system. The question we need to ask ourselves is whether or not that is worth the immense human, social, and economic cost we face. And to me, the benefits of the market system greatly outweigh the risks. I believe that we can create a transplant system for everyone, and that it begins with education. That is why I'm here giving this talk today. The more people who understand the benefits of this idea today, the more likely it is that the lawmakers, physicians, and politicians of tomorrow will work to implement it in the future. Together, we can create a system around fairness and access to life. To finish today, I want you to imagine that you yourself need an organ. Maybe it's a kidney, a liver, a lung, maybe even a heart. Without this organ, you won't live for long, and the days you have left will be painful. You have two options. You could add your name to the transplant list, wait for half a decade or more in pain, pay hundreds of thousands of dollars in treatments that may or may not bring you much benefit. And in the end, you might still die waiting. On the other hand, you could pay a fraction of the money that you were paying for treatment, receive the organs in a few weeks, and live a long, healthy, pain-free life. The choice is ours. Thank you very much.